A new study from the UK found the rate of eating disorder diagnoses among girls 13 to 16 years old during the first 2 years of the pandemic was 42% higher than expected. The study also found that rates of self-harm increased by 38%. That's why we're joined by our parenting expert, Dr. Sheryl Ziegler, who's joining us to talk about this. Those numbers, I think we've heard them tossed around, but they're so startling and so concerning at the same time. And what's the connection to the pandemic?
Yeah, well, that isolation, that more time on social media, that piece of depression and anxiety really drives people's mental health concerns. And so if you are vulnerable, then that's the way it manifested with both cutting as well, cutting and eating disorders. And so that was a UK study that came out. We also have one that came out from here in the US as well that said double, that their rates had doubled from what they were pre-pandemic during the pandemic. So really just another part of this mental health crisis.
Obviously, it's very critical when you think about the danger that lies therein. But are some of these things, I guess, in an odd way, hopeful in that we're looking for it more? Well, that we are finding it more because we're probably looking for it more as well.
Exactly. I think that when I read reports and studies like this, I say, okay, well, what can we gain from this? And this is, you've got to know the signs. And so we know that this is out there. And this study was really, both were focused on girls, but boys, I just want to put out there, are definitely not immune to this. We see eating disorders in boys as well. But you really, I think for parents, what they want to get from this is to say those two conditions, cutting and eating disorders, are two of the ones that kids try to hide the very most. So you actually really do have to be vigilant. That's the word that the researchers actually used, was be vigilant, because it's kind of easy to miss because they work really hard at hiding it. So that's what parents want to do. They want to watch for those signs. They want to see, is your kid eating less? Are they going to the bathroom right after they eat? Are they really focused on health foods? That's one too. Overly focused. So slightly focused, maybe okay. But that high level and real concerned if there's not something what they consider to be healthy in the house, they get very anxious. Those are some of those warning signs that you want to look for.
Yeah, and you would think sometimes the summer is good or bad for figuring that out, because sometimes they're spending more time with their friends. But then I think if you think like July 4th, everybody's eating foods that aren't probably the healthiest, and you take note that your child doesn't seem to be eating anything, maybe that's something to tap into.
Absolutely, and there's the two key factors too of not being comfortable and confident in your own body. So if you hear your kid making disparaging comments about their body or their appearance, that's a red flag. And then also just overtly wanting to lose weight. If they say things like, I'm fat, or I want to lose weight, those are things to really pay attention to.
But what do you say back? Because you're not supposed to say, no, you're not. Right? What do you say back?
So some of the things you say are, tell me about it. What are you unhappy with?
Okay.
Where do you think you would be happy? When have you ever been happy with yourself? So you start inquiring, you get curious, you stay calm, right? Because you can get alarmed, like, oh no, this is supposed to be red flag. But stay calm, stay curious, ask questions. Their answers will lead you to, okay, maybe this is mild, or maybe this is something we have to address. And if you have to address it, just like we were talking about, reach out. There are specialized eating recovery programs, eating disorder programs, even disordered eating we've talked about before. Reach out, because there are waits. And even if you're just not sure, it's okay. Just reach out, get an evaluation.
This isn't new, but it maybe is growing, or maybe we're seeing more of it. But how broad a straight line can you draw to social media? Both the negative side of being insulted or being criticized for your appearance, or that false positive you see of everyone else is built differently than I am. Everyone else looks perfect and I don't.
I think the research is working on it. I think that me in the field, it seems pretty closely tied together. When you are so young and you're so impressionable and you're seeing images, many of them which are filtered, many of them which are doctored up and you don't know it, and you're comparing yourself. It's interesting, the age 13 to 16, you're very vulnerable. And so I think there's a pretty close link. So watch what your kids, you're not going to be on top of everything, but what are they looking at? How much time are they spending on there? The more we can decrease that and just get them outside and hanging out with friends, the healthier they really are.
Well, it's something important to talk about, and we're glad you came in today to at least get us thinking about it, talking about it again. Thanks, Dr. Sheryl Ziegler.
Yeah, thanks for having me.